What's up, everybody, and welcome to this week's episode of the Well Man's Podcast. My name is Bryan Brozy. I'm joined by my friend and co-host, Keoni Tita. Keoni, how are you today?
I'm doing good. I'm excited about our topic today.
Yes, me too.
It's one of these, it's an very insidious disease. I mean, I would say, gosh, I don't know. I think I wouldn't be too far off saying probably like close to 40% of our country or individuals in it have at least the beginnings of what is called fatty liver disease. It's closely associated with, as the name implies, being overweight, of course, but also it's very closely related with insulin resistance.
So what's kind of going on there, Keoni? Like the liver's just getting fat?
Yeah, pretty much. The liver's getting fat. I mean, that's what you see. If you actually looked at the liver, you would see these little spots of fat globules all over the liver. It's almost like creating human pate, right? You know how they make pate? They basically, from what I understand, it's awful, but they force feed these ducks until their liver gets extremely fatty. And that's what you make pate out of, from what I understand. But anyway, so it's like that. Your liver is just storing fat and becoming more and more congested to when eventually it just becomes super inflamed, and then it switches to something called NASH, or non-alcoholic steatohepatitis. So basically what it is, it's kind of like a spectrum. It moves from non-alcoholic fatty liver disease, right, which is usually brought on by insulin resistance, being pre-diabetic, being overweight, and as your body's trying to compensate and you are gaining weight or being sedentary or eating lots of white foods, it can then switch into NASH, or non-alcoholic steatohepatitis. And you understand the designation where they're saying non-alcoholic steatohepatitis. As a physician, you just really want to make sure that the liver is not inflamed due to alcohol, right? So alcohol can cause inflammation. So hence the name non-alcoholic steatohepatitis. But, with alcohol, speaking of alcohol, alcohol actually causes, the liver to be inflamed too. And there's studies that show, like, somebody who has more than a couple drinks a day can definitely exacerbate the condition, but also increases their risk of that non-alcoholic fatty liver to then switch into, it being inflamed. So you get that, steatohepatitis, or the fatty liver, or non-alcoholic steatohepatitis. Okay. So does that make sense? Going from non-alcoholic fatty liver disease to NASH. So NAFLD to NASH, non-alcoholic steatohepatitis.
Okay.
Yeah. So we're really talking about at the cellular level, liver injury and in the liver. I mean, that's what you are doing. So as you gain weight, you are injuring your liver and it becomes inflamed. And one of the ways that you can do that is just through normal Western lifestyle things. So think about like eating plenty of white foods, slowly gaining weight, even age-related weight gain you can put onto that, being sedentary, white foods. And then on top of that, like we don't even think about this stuff. So our liver is congested, it's compromised, and then because of that, you get this surge of inflammation, this insidious swelling of inflammation all over the body. You think about getting joint pain and stuff like that. And then what do people do? Then they're going to go to NSAIDs, right, like ibuprofen or something like that, and pop those. Those things have to be detoxed by the liver. And you want to add fuel to the flame, so to speak. Just take a bunch of like NSAIDs and have your liver deal with that while you have non-alcoholic fatty liver disease. It's just not a good combination, and you're just going down a path that's just going to create a lot of problems.
Yeah. So it seems like, Keoni, this is coming up for people a lot, just based off diet and lifestyle, which seems to be a running theme for us.
Yeah. Well, it's crazy because we don't know a whole lot about it. Like it seems to have exploded over the last few decades.
Okay.
This, all right, but yeah, and the one thing we do know is that lifestyle plays a very, very big role with it. I mean, there's no doubt. Like the sedentary lifestyle, gaining weight, overconsumption of calories, and one big thing that we do know also is that though it depends on really where those calories are coming from, for one thing, but
Hmm.
fructose seems to be very aggravating to it. So think about a high fructose diet.
Sure.
So fruit juices, tons of fruit, um, you know, uh, anything sweetened with fructose will make it worse. So that's one of the first things we do.
Right.
Yeah, if you like your sweets, get away from the fructose to help reverse this.
Now you kept saying, was it white foods, Keoni? Is that what you were saying?
Yeah, when I say white foods, I'm just talking about refined
Mm.
carbs. Basically breads, pastas, pretzels, cakes, cookies. That's basically what I'm talking about. Think about the things where white flour is used, any
Gotcha.
type of flour is used, and over consuming starchy stuff. That definitely can exacerbate it. So that tells you about one of the ways that we help treat it. In my
Hmm.
clinic, is we just we really have to get away from all of that. So
The first thing that's coming to my mind to kind of slow this down would be some of the fasting we've talked about.
oh, absolutely, intermittent fasting will definitely help, because what are you doing with fasting? You're actually decreasing insulin resistance. You're lowering glucose levels by putting or blood sugar levels by putting more space between your meals. Therefore, insulin can go down. Therefore, you can start burning extra fat, right?
Right.
Um, and if you're burning extra fat, it's like your liver can do a clearing out. So yeah, fasting will help most definitely for this.
Mm. We've got a whole episode on that. I think it was
Right.
60 something maybe. Don't quote me on that, but it's intermittent fasting. We detail how to do it. And
Yeah, I think it's like 33 and 60. Do we have two of those? I think so, if I'm not mistaken. But it's unfortunate because non-alcoholic fatty liver disease is bad enough, but about 1/3 of those people will progress to the more serious condition of NASH. And of those, 20% will go on to liver fibrosis and cirrhosis, and which then that leads to liver cancer and liver failure. So you're increasing your risk of liver failure and liver cancer. Um, you know, and that's an awful way to go. And you certainly don't want to add insult to injury by drinking alcohol if you have this disease and taking a bunch of prescription meds, especially the over-counter stuff. But the more prescription meds you take, the more burden, toxic load you're putting on this.
yeah. Well,
Um,
let me ask you, Keoni, because I'm not too familiar with this. So as far as how people are going to know that they maybe have this, how are they going to find that out?
That's a great question, because it's really hard, and most physicians aren't even thinking about it, right? Um, I mean, the signs are really not frank. They're not blatant
Correct.
at all. Okay, so you may with non-alcoholic fatty liver disease or NASH, you may have mild discomfort in the upper right quadrant of
Mm.
where your liver in your rib cage or in your stomach. You may feel that occasionally. So when people say, yeah, I just feel a little sore in my liver area or anything like that, that can be a sign of
Okay.
something going on. But a lot of times physicians will basically run blood labs on it and may see elevated liver enzymes. Okay. And that's going to warrant further, you know,
Further check in.
investigation
Yeah.
of, what may be going on. But those liver enzymes, are not that they're not diagnostic by any means
Yeah.
of this. So
Right.
you really have to take it as a complex of signs and symptoms. Other things that can be elevated with it are things like inflammatory markers, like high cardiac CRP. We've talked about that on a number of podcasts, but that's an inflammatory blood marker, right? It's C-reactive protein that, as we see increases in the blood, it means you have more inflammation in the body. And, having a congested liver definitely increases more inflammation in the body. Another one is TNF alpha. That's another inflammatory marker. One of the blood labs that I run quite a bit, I call it an anti-aging blood lab along with CRP, is hemoglobin A1C. They run that on anybody with diabetes periodically, but I think it's a great, and pre-diabetes, I think it's a great anti-aging marker for just getting a sense of health and wellness. And the lower it is, the better without low blood sugar symptoms. So if you're diabetic, pre-diabetic, you're going to have a hemoglobin A1C of 5.7 to about 6.4. Anything above that's going to be diabetic. But anytime you have that, anytime you're in that pre-diabetic range, you can rest assured your liver is probably stressed. All right. And it's highly likely that you have non-alcoholic fatty liver disease.
So as far as someone diagnosing you with this, Keoni, are they taking a tissue biopsy, or is it just kind of like you mentioned, a conglomeration?
It's the only way to get a definitive diagnosis of this, right, is to do a biopsy. Okay. And it's not, again, it's not that cost effective to do that, right?
Right.
I mean, and so you really have to, it's kind of a stepwise process. It's blood work. All right, let's see what's going on. All right, you still having issues. Let's see if the liver enzymes go down. A lot of times I just treat it by doing what we talked about without even making a definitive diagnosis. I'm like, okay, we got to get rid of the white food. We got to fast, your BMI is way up. Your body fat is way up. This is a likely thing that can be happening.
Right.
If somebody wants to go through that, they certainly can. Other ways to get a good idea of it is doing like an ultrasound, and you can kind of get a picture of what the liver looks like. But that's sometimes that you can be, mistaken with it. But
Sure.
The definitive diagnosis is a liver biopsy.
Okay.
The other thing that you see with this, besides the other things that go along with it, right? When we talk about diabetes and obesity, we also see increased risk of cardiovascular disease. With all of that, you see increased risk of high blood pressure. So yes, that's something that's kind of fits into that constellation there. And then one thing that we see is high levels of serum ferritin and probably high iron saturation levels. Serum ferritin, it's a protein that helps store iron. These things go high, and the higher the level of iron is in your body, even within the storage form or in the blood, the more inflammation you possibly can generate. So that's one thing that can help you get closer to a diagnosis without doing a biopsy.
Yeah.
Just one other thing is, this is not solely a lifestyle disease. Some people are actually genetically prone to it too. So I just want to put that out there, more so than others. And you don't have to be overweight or obese or have insulin resistance to have this, although it's highly unlikely.
Gotcha.
All right,
okay.
So,
yeah.
But let's just go into preventative measures of treatment, because this is really the most important thing. We already mentioned you really should avoid or minimize prescription drug use. And we should be doing that anyway. Definitely avoid or minimize anything that puts stress on the liver, like alcohol or high fructose foods or the white foods. Minimize over-the-counter drug use. Avoid consuming too many calories. Move consistently. Exercise. Man, we just did a whole series on sleep. I mean, sleep is not compatible with over consuming calories, for sure. Most of the time, I should say. You're certainly not going to eat while you sleep. That is huge. So getting plenty of sleep so the body can recover. Increase your consumption of liver supporting foods. So green leafies do this: spinach, kale, arugula. Dandelion greens are one of the best things for this because they're bitter, and there's compounds in dandelion that just help support the liver. They also help support contraction of the gallbladder, which can help get rid of some of the congestion in the liver. Increase your consumption of sulfur-containing herbs and vegetables. We're talking about the smelly ones, right? Garlic, onions, broccoli, cauliflower, cruciferous vegetables. Any type of bitter foods can help. I actually, in my clinic, to help with liver, the liver function is just, I will give tincture of bitters a lot of times. And these things contain very bitter herbs in there, like artichoke leaf, gentian roots, dandelion roots, what else? Citrus peel. Things that taste bitter help get the liver moving and get the gallbladder contracting and just keep it healthy and make sure things are moving along okay. One bitter thing that we consume in this country quite a bit is coffee. Black coffee may help here also with that. So those are just some lifestyle things that can certainly help quite a bit.
And so it's that bitterness that we're looking for to kind of, like you said, stimulate the gallbladder and, for lack of a better word, flush out the liver and kind of keep things moving.
Yep, you can absolutely think about it that way. One thing, since we talked, just to take a few steps back, we talked about iron levels. Well, there's a condition. We actually did a podcast on this back at episode 41 on hemochromatosis.
Yeah.
It's elevated iron levels. Anybody with hemochromatosis is going to be at much higher risk for this. And anybody with hemochromatosis really has to take really good care of their liver. So I just want to throw that out there. But go check out that. If you guys are listening, go check out that podcast. That was really good. We had a wonderful guest on that time who really...
Most listened to episode ever.
Oh, yeah. Yeah, he was great.
Yeah.
And so with the lifestyle stuff, there's a whole lot of things. The next step in the therapeutic ladder is what I talk about or want to go to with my patients is nutraceutical interventions. All right. And I forget the number of this podcast, but we talked about glutathione, right? Glutathione is your body's main antioxidant, and you want to really help support glutathione. And one of the best ways to do that is by supplementing yourself with N-acetylcysteine.
I see a lot of things I know or that we've talked about on here.
Yep. N-acetylcysteine is the precursor to glutathione, and it will protect your liver from environmental toxins. It's used conventionally with ibuprofen poisoning, right? It just supports the liver. So, that's the first thing that they will do. If there's any type of suspected mushroom poisoning or drug poisoning, especially like ibuprofen, acetaminophen poisoning. One of the herbs that we see a lot to help support liver health is milk thistle. This has a long history of use in traditional medicine. It's been shown to reduce inflammation in the liver, reduce viral load in the liver, especially if you're dealing with other forms of hepatitis, like A, B, and C hepatitis. By the way, these are things you want to rule out with fatty liver disease, right? Make sure that it's not some other form of liver compromise like hepatitis. But milk thistle has been shown in studies to help prevent fatty liver cirrhosis, and even liver failure. One of the main drugs used conventionally to help with this disease is a drug called metformin, and it's used mostly to help treat basically the early stages of diabetes, and it has a ton of studies on it. And if I had to give a gold star to any pharmaceutical med out there that I really, really like and what it can do, and based on all the evidence, it would be metformin. And I bring that up because that's conventionally the way they treat it. What does metformin do? It basically decreases your insulin resistance. And we know that insulin resistance is one of these signs of fatty liver disease and NASH. Well, there's actually a nutraceutical out there called berberine that acts a lot like it. And it's basically a natural alternative to metformin. It has multiple benefits. Like metformin does, and berberine just does not have the the negative side effects that metformin does. And it will improve blood sugar and lower your hemoglobin A1C, helps with blood pressure, helps with optimizing blood lipids, overall just protects the liver.
What type of foods are we going to find that in, Keoni?
As far as berberine?
Yes.
You're not going to find in a whole lot of foods. It's derived from a lot of herbs, and a lot of the herbs that it's derived from are very bitter. So berberine is found in Mahonia. It's found in yellow dock, I think, goldenrod.
So you got to know a Native American to find them.
yeah, you do. But it is easily found as a supplement, berberine. Okay. And that's the way I dose it. I don't try to get berberine into my patients with just herbs, because you're just not going to get enough.
I see. Okay.
What else? Another one that's pretty cool is good old simple vitamin E. Vitamin E is a powerful antioxidant. It's really interesting. There's a study done on Actose, another insulin sensitizing drug like metformin and vitamin E. Patients receiving both vitamin E, it was 400 IU per day, and Actose, 30 milligrams per day, had improvements more than patients that were on only vitamin E alone. So the combination of the two drugs seemed to really help. In a follow-up study to that, they just did vitamin E, but up the dose to 800 IU per day, or Actose, 30 milligrams per day, or placebo. So you had 3 groups there, and both treatments improved levels of liver injury markers, but vitamin E actually had more significant improvement than the drug. So I thought that was pretty cool. Vitamin E is a powerful antioxidant. Vitamin E is found in nuts and seeds. As a supplement, it's very, very safe. Take a good multivitamin. We talked about this on one of our other podcasts. You want to make sure your multivitamin has a complete complex of vitamin E. We know also part of the reason why these studies were done is that people with fatty liver disease have depressed levels of vitamin E in their blood. And if you have that, you're going to get more oxidation. You're going to get more inflammation. So this is one of the reasons why they did that. So simple, good old vitamin E really, really seems to help. And there's tons of studies on vitamin A, though on vitamin E, lots of positive studies on it. Yeah. One of my foundational things I do for all my patients is they'll always get a well plan. And one of the things I do for most of them, not all, but most of them, I will put a high potency multivitamin, usually, especially if they have any type of disease state. And then I will list on, take your fatty acids like fish oil, omega-3s. Those 2 things I think are key and go a long way to help preventing, and as we're going through here, likely help treat fatty liver disease. But real quick, the reason why I like omega-3 fatty acids for a whole host of conditions, many of which we just mentioned, is it basically helps cells to communicate better. A lot of these fatty acids help make the cell membranes more fluid, and therefore the cell membranes can talk to one another and can have more effective communication through cytokines, inflammatory markers, and they know where to pull resources to the body to help the body heal itself. Right. We know that unsaturated fatty acids like omega-3s show in studies that they improve insulin resistance or insulin sensitivity. They also help suppress the body making new fat cells. They also help suppress the liver, kind of like storing fat in itself. So these omega-3s are really important. One study it was a human trial, 1,000 milligrams a day of omega-3s, significant decreases in serum markers of liver cell damage, triglyceride levels, and fasting glucose with omega-3 supplementation. So that's pretty cool. and that's with just 1,000 milligrams of omega-3s. That to me, that's a pretty low dose when you supplement with it. I mean, I usually do at least double that dose of that, but it does go to show that even lower doses can help people if they get a good omega-3 supplement. Yeah. Another study found with omega-3s that, gosh, what was it? EPA and DHA, these are the main constituents within omega-3s that seem to have the most benefit. Supplemented for 24 weeks, decreased triglycerides, triglyceride levels in people with fatty liver disease. Triglyceride levels go through the roof with fatty liver disease. Another fat that does help, not as many studies on it, but olive oil also can seem to help to lower triglyceride levels in fatty liver disease.
Interesting.
Yeah, so olive oil can help. So part of the reason why the Mediterranean diet may be so beneficial. Another supplement that I will use, I think it's to find a good supplement, it's a little expensive, but is S-adenyl methionine or SAMe. This one, just like NAC can replenish glutathione stores or help replenish it. And I think one study showed that 1,000 milligrams or 1,200 milligrams of SAMe significantly increased glutathione levels. And
that's interesting, Keoni. My first interaction with this drug is my dog had to take it when it had liver disease.
Yeah. It's an incredible nutraceutical. I mean, it's really, really cool. It's a good supplement, but it's one of those things that basically all you're trying to do is just support glutathione levels and liver antioxidant stores so that you decrease the damage from all the inflammation from the fatty liver disease. On ultrasound, or pathology biopsies, it definitely improves the microscopic features of fatty liver.
Yeah.
So you get decreased fat deposits, decreased inflammation. You don't see the tissue death that you see in the liver.
Keoni, with this, is the biggest problem that the liver is just not functioning optimally? And then on
absolutely,
top,
just sum it up with that. The liver cannot do what it's what we call in Chinese medicine, or for in layman's terms, in Western thought, is just liver congestion, and in Chinese medicine, significant liver qi and blood stagnation. The liver just cannot do its thing.
Okay.
All right.
And it's the powerhouse of kind of cleaning out the body.
It is the main organ of elimination. And again, it's like, if you want to go on a detox, you better think about taking care of your liver. That's the main thing. Take care of your liver, however you can do that. If you want to do a detox, you have to support liver function. And a lot of things we do in Western lifestyle does exactly the opposite.
Yeah. Well, it's so funny too. We did a whole episode about detoxing.
Yep.
But you see so many people do detoxes by drinking only this or eating only this or that sort of thing. And
they take any type of pill.
Fasting.
Yeah. They take a pill and think they're detoxing, or they take it's just craziness to me. They take like some type of detox pill, which most of that is a sham, but they take a detox pill and then later that night they go out with their friends and drink 4 or 5 beers. It just
liver's in overdrive.
Right.
Processing that pill, the beers.
Yeah. Well, one last thing about SAMe is it seems to directly stop the progression of relatively mild fatty liver to the dangerous non-alcoholic steatohepatitis or NASH. Which is really, once you get to NASH, you're really, really becoming in a dangerous place, because now you're talking about a really high possibility of liver cirrhosis and liver failure and liver cancer.
So at what point, Keoni, it definitely seems like you just mentioned, NASH is when you're really in the danger zone. At what point does it become too far, too gone? Or do you have to, to go to conventional treatment?
Yeah. Well, too far, too gone is when there's nothing else you can do. And pretty much, you're in liver failure.
Mm.
right? Or you're put on a liver transplant list. And the reason why I say that is because the really cool thing about the liver, it has an amazing capacity to heal itself. I mean, I have heard that you can actually take your liver and cut like a third of it off of you, and it will regenerate itself. I mean, it's one of the only organs. I mean, that's similar to like cutting off your hand, and then you get a new hand a few months later because it regenerates itself. It's like,
Yeah.
we're talking about some lizard physiology here that
Yeah.
that we have in our liver. So the
Tune in
liver
next
is
week and we'll try it with Keoni.
yeah, try to grow it back. But it's an amazing organ, but it we abuse the heck out of it, and it's
Absolutely.
amazing what it does without all the nonsense we put into it
Mm.
daily, right?
Right.
So yeah, it's an incredible organ of elimination, and it does so much more than elimination. I mean, it does so much. It helps the make proteins that are absolutely necessary in your blood and body. It supports digestion. I mean, the lists go on and on. In Chinese medicine, it's considered, I don't know, I would think you can make a good case for, as far as the Chinese organs going, that it's the most important, you know?
Mm.
And I think you can make a good case here too, besides the brain for us. I mean, it's a very, very important organ.
Yeah.
So we just need to take good care of it. Let's see, what haven't we talked about? Just real quick, resveratrol. We've talked a little bit about this. Resveratrol protects liver tissue, again, against antioxidant effects. It's a great thing to help buffer the impact of alcohol also. It activates two critical signaling molecules, SIRT1 and AMPK. These are both inhibited by alcohol and also dysfunctional in metabolic syndrome. Animal studies show that resveratrol, as we just implied, activates SIRT1 and AMPK, which in turn reduces fatty liver accumulation, and it suppresses new liver fat cells from forming. So it reduces insulin resistance.
Yeah.
And let's see, we talked about the liver and its close ties to the GI function. So let's just talk about probiotics and prebiotics, because I think those are important also. A lot of people kind of think, oh, probiotics, prebiotics, just for, helping your gut. But what we're finding with supplementation with these things at the gut level actually have intimate connections with helping support brain function, supporting liver function, supporting kidney function, supporting skin function, all these types of things. So it's very important to make sure that we keep the gastrointestinal tract, which is where the main part of the immune system resides, healthy. And probiotics and prebiotics tend to do this. Just real quick, probiotics are basically good, healthy gut bacteria. You're actually taking a pill of this. So probiotics are bugs, but healthy bugs that are good for your gut flora. And prebiotics are basically the non-digestible food ingredients like fiber and stuff like that actually help support the growth and metabolic activity of the probiotics or the intestinal bacteria that we have. You have to keep those healthy to make sure that you keep inflammation down and to make sure that you keep your liver healthy. So in some trials, probiotics were found to significantly reduce liver enzymes. Again, liver enzymes are elevated when the liver is compromised. It actually helped reduce TNF-alpha, an inflammatory marker. It actually helped improve insulin sensitivity and lower total cholesterol. That's with just supplement with these two, which is amazing to me.
Yeah.
Because you're not even treating those things basically directly in a Western conventional sense. In a double-blind, placebo-controlled study, 52 people with fatty liver disease took a synergistic prebiotic-probiotic blend, and they were compared to placebo. And both groups followed dietary and physical activity recommendations. The treatment group with this blend demonstrated improved inflammatory and liver function markers compared with controls. This is a very easy thing to do, a very safe thing to do to help support overall body function, especially liver function. Another randomized controlled study with this 64 obese children with sonographically confirmed fatty liver disease. So yeah, they're using like ultrasound and getting a confirmation of it. As we said, ultrasound isn't always a good confirmation of it, but a lot of times it will help. It's just not very cost effective. But they supplemented these kids with probiotics for 12 weeks. At the end of the trial, over half the probiotic group had normal liver ultrasounds compared to just with 16% in the placebo group. So you're talking about, okay, we can see that you have fatty liver disease, and over half the group basically reversed it, which is supplementation of these probiotics. That's fascinating to me.
Yeah, absolutely. It seems like there's a lot you can do, not just in prevention, but
Right.
once you find out you've got it.
And I think we said this, Bryan, at the beginning, but just so you know, you do not have to be overweight or, we said that, right? You do not have to be overweight to have fatty liver disease. You can be lean and still have this. And so anyway, a study that took with probiotics is randomized, double-blind, one of these gold standard studies, took 50 lean people with fatty liver disease, and they gave them a probiotic prebiotic combination thing for 28 weeks. Again, both groups followed a healthy lifestyle plan. Compared with the placebo group, the treatment group experienced a much greater reduction in liver fat and fibrosis, as well as their fasting blood sugar, triglycerides, and inflammatory markers also went down. So that is with probiotics, prebiotics. And we know our go-to specialist on that is Dr. Jillian, my wife, who talks all the time about what this can do for your gut health, but and also how it's related to other parts of the body.
Yeah, she's joined us a few times too, talk about a lot of probiotics, prebiotics.
Yeah. So I guess just to sum up is fatty liver disease is insidious. It's very prevalent. If you don't take care of it, it can turn to non-alcoholic steatohepatitis. So basically, this is where the liver actually becomes inflamed, and you don't just have fat deposits. So it's like a more serious stage. And with NASH, if you don't treat your liver well, it will keep progressing to possibly liver cirrhosis, liver failure, liver cancer, and possibly put you on a liver transplant list, which you definitely don't want to do. You cannot live without your liver. You need to make sure that you get it diagnosed appropriately and do all the rule outs. We definitely don't want to diagnose you with this if you actually have another form of hepatitis, which is a whole another way to treat hepatitis. So any form of hepatitis besides this NASH. The goals of therapy are just basically to reduce the fat in the liver tissue by decreasing fat synthesis and increasing utilization of existing fat stores in the liver. So you talked about fasting, intermittent fasting. That's one way to do it. You want to minimize the free radical production, oxidation there. You can do that through nutraceuticals. You want to reduce or eliminate the inflammatory response of the infiltrated fatty liver tissue. And you just, with that, you can use nutraceuticals, lifestyle to make sure that you reverse it, or at least it doesn't progress to the more deadly NASH.
Right.
Anything else we should talk about with that?
No, it really just seems like something you can easily prevent and easily kind of manage, as long as you're working on it actively. Once you get a diagnosis, before it is that NASH, it seems like something you can really impact.
Yeah, and you can get an idea real easy by looking at your BMI, if this may be a possibility for you. I mean, if your BMI is over 30, you probably have this,
Interesting. Yeah.
Yeah, if your body fat is over, I'd say 30% also, you probably want to really look seriously at this. And that's why it's important for everybody to make sure that they see their doc and get regular blood labs. And on those regular blood labs, you get to see what your liver enzymes are doing. It's a good way to address it, because a lot of times you don't have any symptoms of this at all. And that's kind of crazy. And sometimes, it can be a bit late when you're trying to treat it.
Right.
If you don't stay on top of it. So yeah, check with your doctor, make sure you're staying on top of getting your labs done.
Well, I think we'll end it there. Anything else,
Yep.
Keoni?
That's it. Yeah, I think that's good.
All right, everybody. We'll talk with you next week. Until then, be well.
Take care, everybody. Bye.